Well, hello, it's Bruce Williams again, still sheltering in place, sitting here in my easy chair, and it's time for Gross Path Challenge number 61. If you're ready to go, I sure am, and here is slide number 1, which is tissue from a cat. How about a morphologic diagnosis and name the condition? Okay, time's up. We're looking at a bisected heart. It's laid open. We can see the right ventricle here and here. Here's the interventricular septum here and here, and the left ventricular free wall. The morphologic diagnosis that I'm looking for is diffuse hypertrophy of the cardiac interventricular septum and left ventricular free wall with left atrial dilation. And the condition is hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy is one of a number of variants of cardiomyopathy in cats. Probably the most common is dilatative cardiomyopathy and hypertrophic cardiomyopathy. There are a couple of others that are less common, including restrictive cardiomyopathy. There is a cardiomyopathy associated with replacement of the right ventricular free wall by fat, which is fairly uncommon in cats, more common in dogs. But this is probably the second most common, hypertrophic cardiomyopathy. It is seen in a couple of breeds of cats with increased prevalence, such as Maine Coon cats. And it's also associated with hyperthyroidism, a common condition in older cats, which increases the basal metabolic rate, the demand for oxygen, and then you have concentric hypertrophy of the left side of the heart. One of the things that you can see, and this is a much easier antemortem diagnosis because with ultrasound you can easily see that the hypertrophy of the interventricular septum and left ventricular free wall causes a marked diminution of the left ventricular lumen. I think this can be a very difficult diagnosis histologically. It's easy if you weigh the heart. Generally, I use 20 grams as cutoff for a normal heart. Anything above 20 grams, I start to think about hypertrophic cardiomyopathy. One of our own personal cats had this and died a year ago with a heart weight of 27 grams. And you can get the same weight on formalin-fixed tissue. Just make sure that you trim off all of the pericardium and anything else. Cut the great vessels pretty close down so you get an accurate weight. There's a lot of papers that have been written. A very good one I was just reading, which was published last year in Veterinary Pathology, in which the left ventricular myocardium interventricular septa has an overall decreased cellularity, which is sort of odd since you look how thick they are. But you have an increase in fibrous connective tissue, which is populated by small vessels. You also have an increase in macrophages and an increase in pro-fibrotic mediators, which are probably secreted by those macrophages. So interesting, overall decrease in cellularity, but an increase in certain types of cells, which would include fibroblasts and macrophages. Slide number 2 is tissue from a mouse. Can you give me a morphologic diagnosis? A likely cause, and I rarely ask this question, but can you give me an inbred strain of mouse that is susceptible to this condition? Okay, time's up. Well, it's a white mouse, so that helps us a little bit, but there are a lot of different strains of white mice. First thing that I want you to see is this is an ulcerative blepharitis, so diffuse ulcerative, likely if you put heterophilic in there or suppurative, that'd be fine too. Ulcerative blepharitis, the eye has either been removed or it is ruptured, but you can see that there's a significant swelling of the lids and there's loss of the hair. So ulcerative blepharitis. A likely cause, one of the most common agents that is isolated from these cases is Pasteurella pneumotrophica. It's a very common opportunist. Doesn't cause this, but if you have one of the inbred strains of mice which are predisposed. And the one that is best known for ulcerative blepharitis is the BALB-C. That's been also seen in 125 SV mice as well. But BALB-Cs are big ones. Pasteurella pneumotropica is a very common isolate. And one other thing to mention about blepharitis, it's even more common in nude mice. And it makes a lot of sense because nude mice don't have any hair and they don't have any eyelashes. And eyelashes serve to keep stuff out of your eyes. And if you don't have eyelashes, you're going to be more prone to eyelid and eye orbital infections. So, BALB-Cs, Pasteurella pneumotropica, ulcerative blepharitis. Let's move on to slide 3. This is tissue from a springbok, which is a gazelle-like animal. Tissue from a springbok. It is a exotic ruminant. And I'd like a morphologic diagnosis and a cause. Okay, this is an absolutely fantastic picture of a section of liver, and we see these multifocal to coalescing variably sized areas of bland necrosis. You know, I often say that necrosis is usually covered up with hemorrhage, so whenever you see hemorrhage, you want to think about necrosis. This is what necrosis looks like without hemorrhage covering it up. It is a loss of tissue color. And then because this is necrosis and this is probably pretty acute, you have a loss of vasculature in there. Everything's dead, including the vessels. If there are any inflammatory cells around the outside, they would like to get in and clean them up. But just a great picture of bland necrosis, my morphologic diagnosis. And look, if you look at the surface, it doesn't really bulge like abscesses. It's just necrosis. Here it involves the wall of a large vessel. And it wouldn't surprise me if we took multiple sections, you would actually see some thrombi within some of these large hepatic veins. Morphologic diagnosis of multifocal coalescing necrotizing hepatitis or hepatic necrosis. I'm happy with either of those. And the cause is Fusobacterium necrophorum. This is absolutely a wonderful illustrative picture of what that looks like. Okay, Fusobacterium causes extensive necrosis. It elicits an exotoxin, and it does not generally cause, over time, these may become abscesses. They may be super infected by something like Trupperella, but just plain old Fusobacterium, just these bland, flat areas of necrosis. Can't get a better picture of this. Where did it come from? Probably came from the rumen or the four stomachs. This animal likely got into too much concentrate, went into ruminal acidosis, and obviously didn't kill him, but caused some ulceration. And Fusobacterium is one of the bacteria in the rumen that when the pH decreases and becomes more acidotic, it's a survivor. It's happy with a lower pH. And so the mucosa will ulcerate and it will just slide right in there, get into the portal system, and go to the liver and cause these beautiful areas of necrosis. But nothing else looks like Fusobacterium. This is one I wish they had changed the name, because it used to be, when I was in veterinary school, we used to call this Sporophorus necrophorus. What a great name for a bacterium. But there's no whimsy in microbiologists. Slide number 4 is tissue from a horse. Another fantastic picture from my good friend, Dr. Paul Stromberg. Amazing, fantastic. And I need a morphologic diagnosis, a cause, and name the condition. Okay, time's up. We are looking at the adrenal gland of this horse. And there's tremendous amounts of hemorrhage in the cortex. And remember, I told you a zillion times that if you see hemorrhage, you want to think about necrosis. So we are looking at a multifocal to coalescing, necrohemorrhagic, necro comes first, adrenalitis. Okay, you want to be specific, you can say adrenocortical necrosis and hemorrhage. The condition is the Waterhouse Friedrichsen-like syndrome. There's a syndrome in people. The mechanism seems to be the same in a number of species. Horses, I've seen it in non-human primates. Pretty much any species can get it. And the cause is gram-negative sepsis. And when you have gram-negative sepsis, you have gram-negative bacteria coursing throughout the body. When they are killed, part of their cell wall is endotoxin or lipopolysaccharide. When that is released, endotoxin does a number of things. And what you need to remember is endotoxin whacks endothelial cells. And so you have necrosis of endothelial cells, you have thrombosis, you have hemorrhage and infarction, what we're looking at here, or hemorrhagic infarcts due to endotoxin's activity on the vessels in the adrenal cortex. Now, there are a couple of other more remote possibilities for something like this. You can see this type of hemorrhage and necrosis in animals, horses that are under severe stress, endurance racers, something like that. So you want to think about that. You can also see this in foals, sick foals. So those are a couple possibilities, but when I see this, I'm thinking about gram-negative endotoxemia and Waterhouse-Friedrichsen-like syndrome. What a wonderful picture of this condition. So let's go on to slide number 5. I would, and this is another fantastic picture. This is tissue from a dog. Can you give me a morphologic diagnosis? Okay, time's up. We're looking at the spinal cord. You can see the dura here. You can see what's left of the spinal cord proper. Here's gray matter here, and we have a large cavity. Okay, I do not see the central canal disincorporated in this large cavity. There are a couple of terms that you use when we're talking about fluid-filled cavities or cysts within the spinal cord. The first is hydromyelia, and all of these probably have something to do with interrupted CSF flow and accumulation. There's too much CNF, it's not circulating properly. Hydromelia is when you have too much fluid in the central canal, but it's just the central canal. Central canal will expand, it will get too big. You have necrosis of the gray matter around it. But that's fairly uncommon. Okay, this is more than a central canal. It's expanded. There is a large cyst that is dorsal to that. So this becomes a condition known as syringomyelia. And then there are a couple of breeds of dogs that are predisposed to develop syringomyelia. One is a Weimaraner, well known for that. Animals with this sort of have a kangaroo hopping gait, at least the Weimaraners do, where they both back legs go at once. That's probably due to damage to the spinal cord. Syringomyelia. The other one that you will see syringomyelia, which develops over time, are Cavalier King Charles Spaniels, and they have a number of issues which contribute to the formation of syringomyelia, with that being the last development in this. But they often have abnormalities in the posterior fossa, which is the bony encasement of the cerebellum. And it is too narrow anterior ventrally, posterior ventrally. The cerebellum is sort of crammed in there. They often have defects in the foramen magnum. They may have keyhole type defects. And over time, because of that defect, they have abnormalities in CSF circulation. They have protrusion of the vermis through the foramen magnum, which worsens the CSF problems. And then the CSF fluid, which has gone down and is coming back up to recirculate, can't get in, and they develop an acquired syringomyelia as the last stage of that particular problem. It's a well-known issue, a syndrome in Cavalier King Charles Spaniels, and it's thought that maybe up to 30 or 40% have some degree of that I know the breeders are well aware of it. They're working to get that out of the bloodline, but it can be a real problem with those very nice but brachycephalic dogs. Syringomyelia, right here. Fantastic picture. Slide number 6 is tissue from a dog. Can you give me a morphologic diagnosis? Okay, time's up. This is a somewhat unusual one, but it does illustrate a couple of points. Okay, Williams' rule of bubbles, number one. Number one, when you see bubbles, and I see bubbles here, and I see bubbles here, and I see bubbles here, whenever I see bubbles, even these little highlights suggest there's bubbles. I want to think about cystic endometrial hyperplasia just for a minute. And so I'm going to look at that tissue. I'm going to say, is there any possibility this could be a uterus? And there sure could be, because it looks like there's an ovary here. We've opened up one horn of the uterus. Looks like there's a second horn here. So that helps me out, and that's probably an ovary there. It's sort of folded under. And when you see bubbles in the endometrium, it's cystic endometrial hyperplasia, but I want you to notice these large focal areas of hyperplasia. Cystic endometrial hyperplasia is not always a diffuse finding. There's a little fluid in here, so maybe there's a little hydrometra too. It's not always a diffuse finding. It can be focal or multifocal and form these large polypoid projections as well as this mild diffuse, but we have this marked focal cystic endometrial hyperplasia. So it's not always a diffuse change. Sometimes you'll see these large polypoid areas within the mucosa. It's still cystic endometrial hyperplasia. Slide number 7 is tissue from a chicken. How about a morphologic diagnosis? Name the condition. Okay, time's up. Well, this is a pretty severe case of gout. This is visceral gout. I want you to use that as the name of the condition. Make sure that you differentiate visceral gout from articular gout. They're two very different conditions with different pathogeneses. And so this is visceral gout. The morphologic diagnosis, whenever we look at gout, okay, this is a granulomatous reaction. This is not fibrin. Okay, sometimes you will see a lot of fibrin cases of colibacillosis or gram-negative sepsis in birds, but this has a very different look. It is sort of white. It is sort of powdery. Very characteristically is on the epicardium or the pericardium here. And it's very characteristically do that. So we see the best lesions. This one obviously is on the liver as well. It looks like there's some mycelium. This is sort of a fat bird too. Okay, so morphologic diagnosis. Gout is an accumulation of urates. It causes a granulomatous reaction. So I would call this a multifocal coalescing granulomatous pericarditis, hepatic serositis, and coelomitis with urate deposition. And the urate is key because that's what incites the granulomatous response. So this is visceral gout. And the number one cause of visceral gout is dehydration. Dehydration causes, because birds excrete uric acid. If they are dehydrated, it will build up in the blood. If they have renal disease, it will build up in the blood, and eventually it gets to the point where it starts to precipitate out on the viscera. The number one cause is dehydration, and these are animals that for some reason have, they cannot compete to get to the waterers. They may be crippled, they may have broken legs, severe arthritis. This fat bird perhaps could have been a cage layer with layer fatigue or something. But even the best kept flocks have a low incidence, maybe 0.5% or less, of visceral gout. Because there's always some animals that are older, they just can't compete to get to the waters and they get dehydrated. So it is not something that it really is an indictment of husbandry unless the percentage goes way up. you're always going to see it in even really great flocks. Visceral gout. Okay, slide number 8 is tissue from an eider duck. Morphologic diagnosis and cause. I think that's fair. Okay, time's up. And this is a condition that is seen very commonly in animals that, like eider ducks or penguins, are normally, they're in a very cold environment, and they take them, you put them in a zoo, which if not stressful enough, then they're in conditions that are hot. These are animals that live up north, and you stick them in Washington, D.C., where the summertime is not uncommon, hit 90 or 100 degrees, and that environmental stress causes a level of immunosuppression that they don't get in their normal environments. And this is very common. We have opened up the chest, and we're looking at the air sacs, and growing off of the air sacs are these large, fluffy, gray mycelial growths, something like if you left a cheese sandwich in your refrigerator for a couple of weeks, you may get, or certainly if you left it on the counter for a couple of weeks, you would get. There's also some gooey spots here. This represents a multifocal coalescing granulomatous air saculitis with fungal hyphae. And in the air sacs, there's a pretty high oxygen tension, so you do get these fluffy growths. And this is very characteristic for Aspergillus fumigatus. There can be some other ones in there, but it's almost always Aspergillus. You could see maybe a little flavus. But Aspergillus fumigatus, and a common cause. You see this a lot of times in penguins living in captivity, that just the ambient temperature and the stress of living in captivity will do it. So granulomatous air saculitis, you can also see it in the lungs. I don't see it in the lung up here, but you can also get a granulomatous pneumonia. It can get loose because fungal hyphae are great. The hyphal structure of fungus is very adapted to getting into blood vessels and going elsewhere in the body, but you almost always find it in the air sacs. Slide number 9 is tissue from a stillborn fetus. Can you give me a morphologic diagnosis and a cause? Okay, stillborn fetus are probably an abortus, even better, because we don't have a lot of hair. But what we do have are these plaques on the head or on the muzzle, and usually they accumulate on the dorsal surface of the animal, but often on the face. When I say dorsal surface, it's the neck and the back. And this is multifocal coalescing granulomatous dermatitis with fungal hyphae. Okay. This is a case of mycotic abortion. In cattle, you can have mycotic abortion. In horses, mycotic abortion usually is a result of incompetence of the cervix. In cattle is often the result of ingestion. It's a blood-borne pathogen. It gets in and it colonizes the placenta, gets into the bloodstream. Those hyphae get into the placenta that colonizes it through the blood, as opposed to through the incompetent cervix, which we see in horses. Mycotic abortion, once again, it's a sort of a grab bag, but if you look at all of them, Aspergillus is probably number 1, but you can have zygomyces like mucor as well. Our last slide is tissue from a horse. Can you give me a morphologic diagnosis? Okay, time's up on this one. This is an unusual one, not one that is very intuitive, but this is we're looking at the larynx with the epiglottis, and what we're looking at here is a squamous cell carcinoma. Not horribly uncommon in horses, horribly uncommon in cattle. And it's not because they're looking at the sun with their mouths open and getting too much UV light. It is just sort of a spontaneous thing, which happens in this particular area. And I don't exactly know why you get it in the larynx, but you do. So always think about the possibility of squamous cell carcinoma. Squamous carcinoma in the larynx has a very bad outcome. It's not really an operable thing. So these animals, very high rate of mortality. And that's it for today. I hope you've enjoyed this Growth Path Challenge. I hope you come back tomorrow. I should have another one ready to go for you. You can find these on YouTube channel for the foundation. You can find them on our Facebook page. You can also find them in the JPC video library. If you'd like to go there. And we will continue to put these together. It's a lot of fun for me to do this on a daily basis. So I hope you're enjoying them as well. With that, I want everybody to be safe. I want you to keep yourself healthy. And I will see you tomorrow.